Hey listeners, just a quick note. This episode was recorded at our 2019 annual meeting before the COVID-19 pandemic. Wow, when I say that out loud, that seems like such a long time ago. It was last year, but it seems like a world away. And I know, like many of you, I'm missing those things, like going to meetings, talking to colleagues, being with my friends and family and loved ones. And also, like many of you, I'm hanging in there and just trying to do my best and take it one day at a time, hopefully as we all get through this together. So as always, thank you so much for listening and enjoy the show.
You're listening to the MotherToBaby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Hi, everyone, and welcome to another episode of our MotherToBaby podcast. My name is Chris Stallman, mom of three, genetic counselor, and teratogen information specialist. For those of you who don't know, teratogen information is information we get about exposures that occur during pregnancy and breastfeeding. And exposures can be anything. It can be pollution. It can be alcohol or drugs of any kind. It could be hair dye and anything in between. And what we do at MotherToBaby, a no-cost nonprofit service, is offer information to answer your questions about things that can happen during pregnancy, breastfeeding, in the pre-pregnancy period, and also in cases of adoption. Today, we are recording in San Diego, California from our annual meeting. Once a year, members of the Organization of Teratology Information Specialists, or OTIS, the organization that provides the MotherToBaby service, gather all of our experts together so we can go over the latest information and research about exposures in pregnancy and breastfeeding, collaborate, share our ideas, and then pass the information along to you. One of the other benefits of getting together once a year is that we get to see our colleagues and not only exchange information, but also personal anecdotes and do things like record all together. So today, I'm very happy to welcome two guests who are part of the MotherToBaby network, who are also moms and have particular expertise in exposures. So first, I have Beth Conover, who is a genetic counselor and a pediatric nurse practitioner with us, and she works at MotherToBaby Nebraska. I also have Angela Messer, who works at MotherToBaby California. She is a teratogen information specialist and pretty much a brand new mom to a beautiful little girl. So Beth, Angela, thank you so much for being with us today.
And may I say, you have a super cute tropical skirt on that your listeners can't see.
Thank you, Beth. Yes, it is. It's pretty brightly colored, which I thought would be perfect for the beach atmosphere.
A few palm trees.
A few palm trees. And some mermaids, of course, because that's how we roll. So before we get into our topic, which is going to be seasonal allergies, I do want to say that Beth Conover has written some literature about genetic counseling and the way to counsel people. And when I was in school, I would read all of your papers religiously. And it was such an interesting thing to meet you the first time in the flesh. I remember when that first happened. So thanks for not running away after I sort of fangirled all over you that first time.
That was very kind, and I look pretty normal.
So, as someone who works on the phones and personally, I have had my own struggles with seasonal allergies, and most recently in my last pregnancy with Arthur, it hit me at a particularly bad time of year. He was born in January, and I was just, in Arizona, the flora is always active. And so I was having a lot of trouble with the seasonal allergies. And I know, Angela, being on the phones, being a new mom, that you run into these questions. And of course, Beth, you've been doing this for a long time. I know you run into them too. So Angela, what are some of the common questions that you're getting or that you have about allergies and pregnancy?
Right. So I became pregnant in January and had my daughter in October. So I feel like I had allergies that whole time. Unfortunately, didn't matter when the month was. So we get a lot of calls like Flonase, can I use Allegra, Zyrtec? anything I can use in my nose, in my eye, taking orally for allergies. So those are typically the common medication questions we get for seasonal allergies in pregnancy.
So people usually ask you specifically about one thing versus another. Like, is it okay to use this? Is it not okay to use that?
Correct. I think that is because they've used these medications before they were pregnant and they know it worked for them. But we do also get calls about these medications because they've heard it works and they want to know if it's safe or okay to use while they're pregnant as well.
Yeah, we get a lot of those too. And, Arizona is an interesting climate in that, people have different types of allergies at different times during the year. So we're sort of always on that seasonal allergy kick. Beth, is it similar in Nebraska?
Fortunately, we have 2 seasons of allergies, and then we have winter. No,
Nice.
doing that. No, I think that I too get a lot of questions from women who are really miserable. Allergies are something that can make your eyes itch, your nose runs, you feel like coughing. People will often try to tough it out, but in fact, if the allergies go on, they need to usually do something about it. And so I think the other problem is that it can actually cause things like asthma, which are serious and might interfere with a woman's oxygen or the baby's ability to get oxygen from the mom. So there are good reasons to treat allergies in pregnancy.
And I think that's a really good point too. It's interesting, I found in the last maybe 7 or 8 years of practice, sometimes I'll get calls saying I have allergies, but I don't want to take anything. Is there something else that I can do? Is there a different place to start?
Thanks for asking that. I think we forget that you can start with a non-medication approach if you don't have anything that's very serious. So again, if you have asthma, you're going to go towards a medication. But you can always think of some of the behavioral things, like if you leave your air conditioning on and close your window, the pollen won't come in from outside. I myself have cats and let them sleep on the bed, but if I were allergic to them, I would not allow that, and I would wash my bedding. In terms of doing that, I think part of this is avoiding the triggers so that you don't make your allergies worse.
What about things like saline spray that goes into the nose?
I think that's a great idea, Chris. It certainly is absolutely no risk that we know of if you do it properly. Saline is just salt in some water, and you can wash some of that pollen or whatever's giving you those sneezy symptoms out without worrying about any risk to your baby at all.
So, Angela, going back to you, what are some of the seasonal allergy medication questions that you get being on the phones?
Right. So typically we have women that call and ask, what can I do to relieve my symptoms? Should I take a medication? What can I take? And while at MotherToBaby we do not make recommendations on what they can take, we can give them the latest information out there on the medications that they have questions about. So when they say more specifically, can I take Flonase? I've used Zyrtec before and that works for me. Can I take that while I'm pregnant? That's what we can go over with them when they call us.
Spoken like a true counselor. And that I think is a really important point. We absolutely can provide the information that's available. And there is some, and there are some medications in general that don't have a lot of information. So we can certainly provide what's there. But really, recommendations and medical management need to be discussed with a healthcare provider. And that's part of the reason, why we don't make blanket statements, because each person is going to be unique and their needs are going to be different. And that's why we encourage people to contact us so we can go over their situation in a little bit more detail and give them that information. And that way they're armed with information to go back to their provider and then have the discussion about which medication may be the best for them in their circumstance.
Correct. I think for many patients, a behavioral approach won't be enough. If they really have serious allergies, they are going to need to talk to their health provider about medication. But I think they'll feel better about it if they think about it in terms of first, second, third trimester, how potent it needs to be. I think that they can be reassured that many of the things that we use for seasonal allergies are low risk in pregnancy.
And that's a good point. And I know that there's so many different kinds and different formulations of medications out there. So of course, there are pills that you can take, and some are liquid form, and some you can use what they call intranasally. So basically it's like a nasal spray. And with all of those different choices, it is good to have some guidance.
So one of the things that I find reassuring is there are some older studies on the antihistamines, which are used specifically for allergies, and one of the older ones was chlorpheniramine, and they looked at quite a few women who took it during pregnancy and did not see that it caused an increase of things like miscarriage or birth defects. So that's a very reassuring kind of an outcome study. I mean, I think it's a good idea to talk to your health provider about a couple of different approaches to dealing with your allergies. One would be a pill you might take that would be an antihistamine, something that specifically kind of blocks your body's response to the pollen and other things out there. Most of those that have been studied are older, but some are newer and less sedating. Don't make you as sleepy because you're already tired when you're pregnant. You don't want to be more tired. And so your doctor or your health provider can help you choose one if that's something you really need. There are also things like nasal sprays that are made from steroids, and so they aren't absorbed very much from your nose. That is a real advantage because you always want to limit the amount that something might get to your blood, and it has to be in your blood to get to your baby when you're pregnant. So those are things that you can discuss that might very well be an appropriate treatment for your allergies, particularly if they're serious allergies.
Mm-hmm. Yeah, I just wanted to add to what Beth was saying about intranasal or using medications in the nose. We get a lot of calls from women about using eye drops because one of those side effects of allergies could be watery and itchy eyes, which is also not fun whether you're pregnant or not, but we do get those calls a lot. So I think that can also be looked at reassuringly just because it's less exposure, to cross the placenta to reach the baby in the bloodstream. So that's also something to look at.
So what you're talking about is looking at what is your symptom and then deciding what your treatment might be, as opposed to taking one of the things that I don't particularly care for are combination products, where you might have an antihistamine, a decongestant, a little vasoconstrictor that helps your nose not be drippy, a cough suppressant, and something for fever, when really all you want is something to control your allergies. Well, you're taking medications that may not be high risk, but might have a little risk, and that you don't need because you don't have those symptoms. So I do always recommend that people take something that's kind of a single product instead of a combination product, unless they have all those symptoms.
I absolutely agree. We get the combination question all the time, and we do want people to be well treated and to feel good, absolutely, but we don't want you to have anything that you don't necessarily need. And so I think that that's a really great point, treating the symptoms. And like you said, there can be days when you have all of them together, or that could be your issue in the long term, so what they call a chronic problem. But still, we want to make sure that you're getting the best, most adequate treatment. That is an excellent, excellent point. The other thing that I often tell callers and chatters is that if your symptoms don't get any better, if they get worse, or if new symptoms come up, then you really should consult with your healthcare provider as soon as you can, because it may be, that things are getting worse for you, like your allergies are worsening, but it could also be something different, and they may want to treat you in a different way. And we want pregnant women to be well, we want their pregnancies to do well, so there are times when you would need to consult somebody.
Well, pregnant women can feel kind of short of breath as they get further into their pregnancy and their baby gets bigger. And if you're short of breath due to your seasonal allergies and because your baby is taking up more and more space in your real estate, I think that is, again, a great time to talk to your health provider. One of the nice things about later in the pregnancy is the baby's body parts are already formed, and so you do not need to worry that anything you might choose would cause a birth defect.
Excellent point. Okay, so that was a lot of good information about seasonal allergies in pregnancy. We're going to stop here, but next time we're going to go a little bit further into the topic and then talk about the next phase after pregnancy for some women, which is breastfeeding and seasonal allergies and medications. So as always, I'm Chris Stallman. Thank you so much for tuning in with us today. We hope that you will return and tune in with us in the future. And remember, if you have questions about seasonal allergies or any other exposures in pregnancy or breastfeeding, please feel free to contact MotherToBaby. All of our information, so on how to call us, how to chat with us, text with us, or email with us, is available on our website, MotherToBaby.org, along with our baby blogs and our fact sheets. So remember that you can contact us at any time. We are a no-cost nonprofit service, and we would be happy to go over your questions and concerns with you. And remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit MotherToBaby.org.